Hey everyone, welcome back to all my listeners. This is episode number 4 of season 9. Today is Wednesday, May 24th, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, just remember to please go ahead and follow and support this podcast on Spotify. Because remember, about a month ago, Anchor became Spotify for podcasters. So I'd really love all of your continued support of my content-rich, value-add podcast on Spotify. Now, I've gone ahead and provided a link in my show notes for you to use to show your loyal support of my Paint the Medical Picture podcast on Spotify. And I know, in my opinion, it's so easy to just go ahead and use Spotify because so many of you guys already utilize it for your music playlists, right? So go ahead and download the Spotify app because it's convenient on your iPhones, on your Android phones, and on your desktops as well. Super easy. So another way to find me is on Spotify. So can't wait to see you there. Now, let's go ahead and talk about today's episode, right? I'm going to be featuring in Newsworthy, again, my very popular grab bag, because of course, there is some really juicy news that I wanted to share with you about Cigna's Modifier 25 policy. And I also wanted to go over in my grab bag another feature about a very talked about subject recently, very, very buzzworthy and newsworthy feature on ChatGPT, right? Artificial intelligence. And of course, I'm going to go ahead and close out today's episode and round it out with Spark and a remarkable quote on success by Herman Melville. Now, if you guys have checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and our valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve your coding accuracy as you help all of your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts and start following this podcast on Spotify, as well as the many other platforms that you can find Paint the Medical Picture podcast. I'd really love all of your continued support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my compliance recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. Today's episode is sponsored by Advanced Coding Services, a leading medical billing and medical coding school in the United States. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide online or in person with one-on-one support throughout your training. We are committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced Coding Services, educate, nurture, inspire, reaching back with a hand up. So let's get into Newsworthy, my Newsworthy grab bag. Now, the first grab bag item focuses on the breaking news update that Cigna has postponed implementing their reimbursement policy on Modifier 25. Remember, I discussed this exact same policy change that Cigna tried to make for an effective date last August 2022. Now, the policy stated that payment for our evaluation and management services, E&M services, reported with modifier 25 will be denied if adequate documentation to support that a significant and separately identifiable service was performed is not submitted with the claim. Now, Cigna first announced the policy change in May 2022 and planned to implement it beginning in August 2022. However, the insurer delayed that implementation because of strong pushback that they received from state and national medical professional organizations. So Cigna took their time, they waited a bit, and released yet another policy update for the same thing, right? Again, for our providers to submit documentation when they send out claims with that modifier 25 with a same-day minor procedure service. But now Cigna says it will implement the policy beginning tomorrow on May 25th, 2023. That's tomorrow, like I said. But again, the AMA and our medical societies and our physician groups across the nation once again pushed back, and they wrote in to Cigna to go ahead and please stop this administrative burden that would occur in their practices if this policy were to take effect on May 25th, 2023. So guess what happened? This is the breaking news. On May 22nd, 2023, so just 2 days ago, Cigna once again postponed implementation by stating that they will continue reviewing billing patterns of CPT codes 99212 through CPT code 99215 and a minor procedure on the same day for possible future implementation of the policy. Now, let's move on to my second newsworthy grab bag item, and that focuses on the very buzzworthy topic of artificial intelligence, or AI, in the healthcare arena. Now, OpenAI's ChatGPT was launched last year, if you all recall, and ever since then, there are tons of articles that have been written and tons of white papers, and the gurus and the pundits and all of the naysayers too. Everyone has something to say about ChatGPT in healthcare. Now, the University of California, San Diego Health Group out of San Diego, California, as well as our Wisconsin-based University of Wisconsin Health Group, as well as the other big California healthcare system, Stanford Health, they've all started using ChatGPT in so many ways. They are the groups that even asked ChatGPT itself, right? What does ChatGPT itself have to say? And they asked, and guess what? ChatGPT actually started drafting message responses to these types of questions. So when ChatGPT was asked whether or not AI will revolutionize healthcare, ChatGPT had a response that said, yes, artificial intelligence, AI, has the potential to revolutionize healthcare in numerous ways. Here are some key areas where AI can have a transformative impact. Number 1, improved diagnosis and treatment. AI algorithms can analyze vast amounts of medical data, including patient records, imaging studies, genetic information, and research literature to assist healthcare professionals in making more accurate diagnoses and treatment decisions. AI can help identify patterns, detect subtle anomalies, predict disease progression, and recommend personalized treatment plans. Number 2, ChatGPT goes further and says enhanced medical imaging analysis. AI algorithms can analyze medical images such as X-rays, CT scans, and MRIs with remarkable accuracy, aiding radiologists in detecting abnormalities, tumors, and other conditions. This can lead to faster and more precise diagnoses, reducing human error and improving patient outcomes. Number 3, efficient healthcare operations. AI can optimize administrative tasks, automate workflows, and streamline healthcare operations. This includes tasks like scheduling appointments, managing electronic health records, coding and billing, inventory management, and resource allocation, freeing up healthcare professionals to focus more on patient care. ChatGPT goes on and says it can also participate in the drug discovery and development process. AI can accelerate the process of discovering and developing new drugs by analyzing vast data sets, including biological information, chemical compounds, and clinical trial results. AI algorithms can identify potential drug candidates, optimize drug design, and predict their efficacy and safety profiles, potentially reducing the time and cost involved in bringing new treatments to market. Number 5, personalized medicine. AI can enable precision medicine by analyzing patient data, genetics, environmental factors, and treatment outcomes to tailor therapies to individual patients. This can improve treatment efficacy, minimize side effects, and optimize patient outcomes. Number 6, yes, ChatGPT continues providing answers. Remote patient monitoring and telehealth. AI-powered remote monitoring devices and telehealth platforms can collect and analyze patient data in real time, enabling remote patient monitoring, early detection of health deterioration, and timely interventions. AI can help healthcare providers make data-driven decisions and offer personalized care even more from a distance. Number 7, health prediction and prevention. AI algorithms can analyze patient data to identify risk factors, predict disease onset, and recommend preventive measures. This can empower individuals to take proactive steps towards maintaining their health and enable healthcare providers to intervene early, potentially reducing the burden of chronic diseases. Number 8, support for healthcare professionals. AI can assist healthcare professionals by providing decision support, evidence-based guidelines, and access to the latest research and medical literature. This can enhance clinical workflows, reduce medical errors, and support continuous learning among healthcare professionals. And when asked if hospitals and doctors should be afraid of how AI will change healthcare, ChatGPT said, hospitals and doctors need not be nervous about how artificial intelligence will change healthcare. Instead, they should approach it with cautious optimism and an open mindset. By embracing AI as a tool to augment healthcare delivery, hospitals and doctors can harness its potential to improve patient care, increase efficiency, and advance medical knowledge. Ongoing education, training, and collaboration will be key to adapting to the evolving healthcare landscape influenced by AI. And now it's time for my best practice tips in Trusty Tip. So, in today's compliance tip, let's talk about time. There's still so much time being documented in our electronic medical records, all of our EMRs, with the old template style, in my opinion. That's what I've been seeing. By old, of course, I mean from the 1995 and 1997 style of evaluation and management coding, and coding definitions and coding guidelines. But all of that has changed, right? A big, whopping overhaul of changes have been made since 2021 and our revised E&M coding guidelines in 2023. So with those changes, I want to see our EMR templates being changed and revised as well. So we need to remember to eliminate that pesky and that very vague term, approximately, right? That term approximately is just not exact enough. It's just not precise enough, which is what we need in our documentation to support time in 2021 and 2023. Now, the old phrase, today I spent 25 minutes of face-to-face time with the patient. That's great, right? Because that's more precise. I spent 25 minutes of face-to-face time with the patient. There's not that phrase of approximately, right? So there's improvement there because they're stating an exact, a precise time. But what did you do during those 25 minutes, right? Was all of it face-to-face time, as that statement says, right? Today, I spent 25 minutes of face-to-face time with the patient. The question that I always ask is, what else did you do, right, during that patient encounter on that day? Because remember, based on our new guidelines, our new evaluation and management guidelines of 21 and 23, you can now definitely be capturing much more of your work based on time that's outside of the face-to-face time with the patient. So that would be considered your total time. And that needs to be better documented, right? If we are utilizing time to choose a level of your E&M code. When it comes to total time, these are the types of things you can now start documenting in 2021 and 2023 guidelines and beyond, right? Documentation can better capture that total time, which means what did you do to prepare to see the patient, right? Before the patient gets to the office to see you, what were you doing to prepare yourself to see the patient? For example, you were reviewing their previous tests, or you were obtaining and reviewing their history from elsewhere, right? You received those older records, you received a history from somewhere else, and you were spending time reviewing that information. Or you were also performing that medically appropriate examination and that evaluation, right? That time can count as well if you're choosing time to level that service. And don't forget, you can also detail the counseling and the education that you're providing to the patient or the family or the caregivers. You can also be ordering medications and count that time, and tests and procedures as well. The time you spend ordering those meds, ordering those tests, ordering those procedures, that time can count. And then don't forget, you can also document the time you are spending referring and communicating with other healthcare professionals on the team, right? So go ahead and do that if you're not separately reporting that in a different CPT code, right? If you're not reporting it separately, you can definitely count for that time. And then don't forget, you should be documenting the time it takes you to enter that data, that information into the patient's EHR or EMR, right? You can count that time as well. You can also be documenting the time it takes for you to independently interpret those results, right? So long it's not being separately reported or billed out, right, in its own CPT code. So you can definitely quantify that time it takes you to independently interpret results. And then, of course, any type of care coordination time that it takes you, if that care coordination time is not being separately reported in a CPT code, you can definitely document that time as well, right? So with all of these elements to consider to better capture total time moving forward, right, in 2023 and beyond, you should be remembering to use your time to your advantage, right? Use it for your advantage. Take the upper hand, right, based on this new overhaul of our E&M guidelines. So go ahead and start changing those EMR templates to benefit these new changes and get rid of the old, right? Get rid of that old language of approximately or 50% of counseling and coordination time took place, right? Get rid of all of those outdated phrases in your EMR templates because those are hindering you from not only compliant documentation based on today's standards, right? But it also hinders you in receiving the appropriate reimbursement for your service based on your time. A better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, I focus Season 9 Spark on success. I want this 9th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for success in all we strive to do. So, in this week's inspiring quote in Spark is from Herman Melville. It is better to fail in originality than to succeed in imitation. Absolutely true, right? I think this is an amazing quote that reminds us that we must strive to be unique. We must strive to be innovative. We must aim to be thought leaders. Why should we limit ourselves to just being like the next guy or the everyday gal? I think this quote inspires us to create something new. I think this quote inspires us to not be afraid if our idea is not perfected right away. I think this quote inspires us to keep working hard on that great new idea, to keep working to get it right. This quote inspires us to get up and try again, because after all, the idea is ours. It is no one else's. It is that originality that serves as our fuel, our spark, our motivation to keep on going. I'm happy Herman Melville's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, in my final notes today, I am so happy that the weather is turning much, much warmer, closer to summertime temperatures up here in the Chicagoland area. So I hope wherever you are, you're enjoying some sunshine and some warmer weather. Now, don't forget, we are going to be wrapping up here the month of May very, very shortly in the next week or so. And the emphasis on mental health, although, yes, it is in the spotlight this whole month, it is Mental Health Awareness Month, we should never forget to neglect our mental health and our well-being. So again, time after time, I end my episodes by saying you should please find the time for yourselves each and every day, even if it's just a half an hour, something very, very simple to decompress. It is critical to maintain our balance and our well-being to help support our overall happiness. So I extend all of you that. I hope you all find some time during the week to find happiness, decompress, and find some balance, even if it's just by stepping outside, smelling the flowers, enjoying the sun on your face. So I wish you guys all an incredible, incredible, happy, happy week ahead. Thank you guys so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.